So risk of breast lift with augmentation, there are, other than the main risks of bleeding, infection, wound complications, there's a risk you're going to be too large, there's a risk you're going to be too small, there's a risk of implant malposition where the implant can move, there's a risk of something called capsular contracture where your body forms a scar capsule around the implant. Generally, you don't know that that scar capsule is there. Sometimes that scar capsule can get very thick and it can distort the breast, and sometimes it can even become painful. Those are called capsular contractures, and generally you have to go in and take out the capsule on the implant and revise it. The risk of that happening when you put the implant in under the muscle, which is where it will go, is very low. And the reason for capsular contractures is often unknown, but a lot of times it's due to overactivity. So just take it easy after surgery. Doing a breast augmentation and a lift at the same time is kind of like stepping on the gas and the brake at the same time. A lift tightens the skin envelope and lifts the breast tissue up, and an augmentation adds weight and adds volume. So there is going to be a settling out period afterwards, and there is about a 15 to 20% chance that a revision will need to be done, within the first year or two, just to kind of tweak it to revise the lift. You could have changes or loss of sensation to the breast and or the nipple area. That happens about 15% of the time. But these aren't nerves you can see, and so these are nerves. It's usually from overstretching of the muscle from the implant. It usually comes back, but it doesn't always come back. And then lastly, is the risk of scarring. With the lift, you'll generally have a scar that goes around the areola alone, around and down, or around, down, and across. The scar that goes just around the donut mastopexy, that scar tends to widen. I put a permanent suture in there to try and minimize that from happening, but it can happen. If you have the scar that goes around, down, and across, it's not uncommon to get separations at what we call the T-junctions, where the areola meets the vertical scar and the vertical scar meets the horizontal scar. Those wound separations happen about 20% of the time, and they usually just heal up on their own, so don't be alarmed if that happens. They usually just scab over and heal. Sometimes with the augmentation and lift, we will use something called GalaFlex 3D mesh. That gets sutured down to the chest wall and to help hold the breast and the breast tissue and the implant up. You may feel the mesh. That takes about 18 months to dissolve. So don't be alarmed if you can feel the mesh. That's not uncommon. And then lastly, as we always say, is the risk of scarring is 100%. You will have scars. The only thing I guarantee about the scars is that you're going to have them. So we will have you on a scar regimen to try and minimize the appearance of it.